In this episode of Community Health, I had the pleasure of sitting down with Dr. Adam Land of AdventHealth Medical Group, Orthopedics and Sports Medicine. We talked about family life, growing up in Ellijay, and his commitment to giving his patients the best possible outcomes. So you grew up in this community in Northwest Georgia. How rewarding is it for you to come back and be able to practice medicine in Northwest Georgia?
That was always one of the things I wanted to do. A lot of folks, who I would cross paths with at different points in training, they wanted to be in a big city, or they wanted to be, somewhere, I guess, where they felt like there was more for them to do. For me, I grew up in Ellijay, so that's North Georgia felt like home to me, and I always wanted to be back and serve the people who I had grown up with.
Yeah, that's neat. You could have gone anywhere in the country, and you chose Northwest Georgia because it was home.
Yeah, absolutely. I mean, to me, it's home. I feel like I owe a lot of who I am and my values and everything else to the people that I was kind of raised by, and so it's been very rewarding to come back here and be close to home and practice in this community.
Now, growing up in Ellijay, in a fairly rural community, how fortunate are we in Northwest Georgia to have access to good medical care?
Well, I think we're extremely fortunate, and that's part of my motivation for coming back too, is to help provide good quality care for the people in this area. My father, when he was 16, was involved in an accident where they were hit by a drunk driver in Ellijay. It was at that time, it took about an hour and a half, because there was no local hospital or doctor that was equipped to take care of that. So it was an hour and a half journey in an ambulance to get down to Atlanta to be taken care of. And they talk about the golden hour for trauma and that sort of thing. And I guess growing up, hearing about that sort of thing was always sort of a passion of mine to come back and provide top-notch care for people of this area. I mean, they're very deserving.
Yeah. What do you love the most about Ellijay and Gilmer County?
It's a beautiful setting. It feels like home. It's just one of those places. We get 4 seasons. I grew up loving the outdoors, so I loved being able to, go canoeing with my uncle, or I grew up doing a lot of fishing locally, and loved the springtime, and just thoroughly enjoyed the seasons. But the people of the community were always an integral part of my early memories growing up. My grandparents were in the community, and my parents had been there for years, and so whether it was church activities or school activities, I always felt like I was kind of out in the community, and just really enjoyed being a part of that. My father, for a period of time, was involved in local politics in Gilmer County, so I've got memories very early on as a child, helping him campaign in front of Walmart, again, those were just all things that were part of my childhood memories.
Well, speaking of beautiful scenery, your father, you just took a trip to Alaska.
We did. Yeah.
It sounds like it was a bucket list sort of trip. Yeah. What was that like?
Yeah, that was a phenomenal trip. So, yeah, Dad and I have always been very close, but he's the type of guy who just never asked for anything for himself, and always content to let other people kind of do things, and he's worked hard his whole life, and I enjoyed the trip, but I really enjoyed the time just spending with him and getting to hang out with him and talk to him, and it's a little bit different now, adult to adult, than it was as him coming down on me, for a bad grade or something as a kid. But we had a great time. Got to see the Northern Lights a couple different times, and that was something that he and I had always, both wanted to do. So it was definitely a good trip.
It's pretty special.
Yeah.
And I'm sure it was probably just as special, if not more special, for him.
I hope so. We definitely enjoyed it. We had a good time together, and it's funny. having been away for residency for different periods of time and all, and you know, life happens. You know, I'm busy with my own family. He's, you know, busy and you know, still probably works almost as many hours a week as I do, and you kind of wonder if I'm going to be stuck with him for, you know, 4 solid days, or are we going to run out of things to talk about? But we didn't, you know. So
that's great. So as a young orthopedic surgeon, what's the significance of being fellowship trained? When patients come to you, what does that mean?
I think maybe what it does, it gives them the confidence to know, hey, you know, this guy's got as good a training or as much training as any specialist in any of the major cities that I could go to. So, you know, there's always some concern, you know, if I'm going to go see somebody about, you know, my hand or a difficult foot problem or a difficult, you know, knee replacement type problem. Are they going to be equipped to you know exactly what to do and what to offer, and are they going to know the latest techniques and that sort of thing? So, you know, my hope is that it gives them the confidence to know that you know, they can have the best care right here at home, that they don't need to go to Chattanooga or to Atlanta to find that care.
Now you obviously made the decision to get a fellowship. You didn't have to.
Correct.
And that involved, you know, spending a lot of additional time and education and training down at Emory, top-notch medical institution. Sure. Why did you decide to do that?
By the time I was about halfway through residency, I had really gravitated to joint replacement. And I love every aspect of orthopedic surgery, but it was my background in college was in engineering, and so it really kind of fit my engineering mindset. You know, you have a complex problem. You know, it involves significant planning to figure out the best way to deal with it, and then it really gives you the opportunity to make a big impact in the patient's quality of life. You know, if you just look at how frequently joint replacement procedures are being performed now, and then in the next 15 to 20 years, the way it's predicted to just explode, the need for it, I really think that there's going to be a need not only for surgeons that feel comfortable taking care of the initial joint replacement, but also problems that come along the way. And I think maybe that's been one of the area that's been lacking. You know, there's this feeling, well, I can do your hip replacement or I can do your knee replacement, but if you have to have it redone, that's a whole new set of problems. If you were to have an infection or a fall and an injury, you know, I think there's this fear that you know, maybe my surgeon can't handle that, and maybe they're going to need to send me somewhere else. So again, that appealed to me. I want to be the one-stop shop. If you come to me to have your first knee done or your first hip done, I'm going to take care of it from start to finish. So it's not going to be one of those things where if you run into a problem, I'm going to say, well, let's get you down to, you know, somewhere else. You know, we're going to take care of you, and we're going to, you know, make sure that it's right.
Now, one of the procedures that you feel very strongly about is the anterior approach to hip replacements. Talk to me about the advantages of that. Why is it such a better alternative than traditional hip?
You know, it's actually an approach that's been around for many years, but it was used primarily by orthopedic trauma surgeons for difficult fractures in the pelvis. And maybe 15 years ago, 2 or 3 kind of thought leaders in the trauma world who also did a fair amount of joint replacement surgery said, you know, hey, this offers some distinct advantages. It's a muscle-sparing approach, which when I'm asked, I would say that's probably the biggest single advantage. Because we don't have to cut the muscle, the initial rehab process seems to be much easier. You know, we're able to get patients up a little bit faster. They don't have as much of the weakness and soreness in the first few weeks after surgery. And so to me, that's been the biggest advantage of it. There are some potential pitfalls, so I do think that it's one of those things that requires some special training. And it's something that other surgeons have been reluctant to add to their practice. But for me, it's been something that has I've seen a lot of benefits to the patients by doing that approach.
That's great. So you don't just do hips and knees. What other type of things do you do?
I see obviously a fair amount of trauma. So we'll fix any broken bones. I'll see folks ranging from toddlers all the way up to the elderly with hip fractures. But we'll take care of hip fractures and sprains and aches and broken wrists, that kind of thing. I also see a fair amount of sports-related injuries. So I feel very comfortable taking care of ACL tears and rotator cuff tears and other problems of the shoulder and knee.
And I know personally you do plantar fasciitis.
Yeah.
So I think in many cases people are scared of surgery. But I've heard that the majority of patients that come to see you don't require surgery.
Yeah, that's correct. I'm a very big believer in maximizing any non-surgical option before we proceed with surgery. And most people, I think, are surprised to hear how many things they can try. And I think the people who really give those things an honest effort are a lot of times surprised at how much improvement they get. So, making sure that patients really take care of their overall health in general with good nutrition and maintaining a healthy weight. Those can all be things that help take some of the pressure off the joints. They also, help improve your health so that if you do need a joint replacement at some point, you're better equipped to tolerate it. But physical therapy and injections and some of the newer anti-inflammatory medications are all excellent ways that we can buy people time and in many cases prevent their ever needing to have a hip or knee replaced.
That's great. Now you and your family are very involved in this community. I know you're a Sunday school teacher. Your wife's involved in the school system, volunteering and helping out. Why do you feel it's so important to be a part of the community and to give back?
Again, I feel like so much of who I am and where I've gotten has been because of the people who invested in me. I think about Sunday school teachers that I had and about coaches who worked with us, and some of the teachers I had coming along who really kind of gave me the confidence to know that I could do what I've done. And so, I think it's special to be able to help people as a physician, but to me, it's even more special to be able to, really invest in the lives of the folks in your community, even outside of the hospital and the work setting. So when I'm able to, teach those kids in Sunday school or, whatever that we find ourselves doing, that's a rewarding thing.
Now, you guys have 2 young children. What do you, when you think about their future, what do you want their future to be?
Well, we want them to follow the Lord's leading for their life. That's our first thing. We teach them that's the most important thing. But I think I want them to, again, to have a realization for how much comes from the way that you were raised. So, growing up in Calhoun like they are, being part of that school system, being part of the the rec department and all the activities that they're involved in. I mean, those things help shape who they are, and I want them to have a recognition for that so that they have an appreciation for it when they get older. As far as what they do, I mean, it alternates from being a fighter pilot to being a baseball player to being a whatever, and so I'll be supportive of them as long as they have a plan to be out of the house by the time they're in college.
I hear you. The last thing I wanted to ask you is, I know you're young, you're at the beginning of your career as an orthopedic surgeon, but look 25, 30 years down the road.
Yeah.
What do you want your legacy to be?
I think at the end of the day, what I want more than anything is for people who think about me to know that I did the best I could for them and for this community, and that I don't want them to ever feel that I was in it for myself. I want them to know that that I really bent over backwards to take care of them and their family members as best I possibly could, because that's what I try to do. I've always loved our hospital's mission of extending the healing ministry of Christ, and to me, that's what I try to do every day. And whether I do a good surgery or not, really to me is somewhat secondary to making sure that people know where I stand in my faith, to making sure that they feel that connection, whether it's a simple prayer I pray with them, or just being willing to spend an extra minute in office talking to them. To me, those are the things that make the lasting difference, even hopefully when their hip arthritis is taken care of. So,
well, that's tremendous. I want to thank you for all that you do for the hospital, for our community. You've been a great addition to our team here, and I appreciate you spending a few minutes visiting with me today.
Absolutely. It's been a pleasure so far, and I look forward to many years to come.
Thank you.
All right. Thank you.